Why does it take so long to get lymphoma test results? Getting a diagnosis for lymphoma can feel like a waiting game, especially when you're eager to know what's happening inside your body. The reason it takes time is because diagnosing lymphoma, including non-Hodgkin lymphoma, involves many detailed steps that need to be done carefully to ensure accuracy. When doctors suspect lymphoma, they usually start with a biopsy, which is a small sample of tissue taken from a lymph node or other affected area. This tissue then needs to be processed in the lab. The process involves preserving the tissue, embedding it in a special medium, slicing it into very thin sections, and staining it with chemicals that highlight the cells. This detailed work typically takes about 1 to 2 weeks. If a bone marrow biopsy is also needed, the sample must go through a process called decalcification, where calcium is removed so the sample can be examined properly. This step adds another 1 to 2 weeks to the timeline. Sometimes, additional advanced tests are necessary, such as immunohistochemistry, flow cytometry, or genetic testing. These tests help identify the specific subtype of lymphoma and its characteristics, which are crucial for choosing the right treatment. These specialized tests often requiring sending samples to different laboratories that have the right equipment and expertise, which can add several more weeks. Diagnosing lymphoma isn't just about one test. It involves a combination of blood tests, imaging scans like CORT or PET scans, and multiple biopsy results. Blood tests can usually be done quickly, but some specialized blood work may take longer. Imaging scans provide important information about where the disease is located and how far it has spread, and their results typically take a few days to a week. Combining all these results helps doctors determine the stage of the lymphoma, like whether it is limited to one lymph node region or spread more widely. Accurate subtyping of lymphoma is also essential because different types respond to different treatments. This process involves detailed pathology and sometimes genetic testing, which takes additional time. Staging, especially for early stages like stage I, requires careful integration of biopsy, imaging, and sometimes bone marrow results. Because of this complexity, the entire process can take from 1 to 3 weeks or even longer if extra tests are needed. Laboratory and pathology teams are highly skilled but often have busy workloads, and some tests requiring rare expertise or special equipment. This can cause delays, but it's all part of making sure the diagnosis is correct. Once all the results are in, the medical team reviews everything together to confirm the diagnosis, determine the stage, and plan the best treatment. This coordination adds a little more time but is vital for personalized care. In most cases, patients can expect to wait about 1 to 3 weeks to get all the results. This may seem like a long wait, but it's necessary to ensure the diagnosis is accurate and complete. Especially for stage I lymphoma, where the disease is localized, precise staging helps guide the most effective treatment options. If the wait feels especially long or stressful, it's important to stay in touch with your healthcare team. They can provide updates, answer questions, and support you through this process. Remember, thorough testing is key to understanding your condition and choosing the right path forward.